Hi everyone, Dr. Martin here, and I want to tell you about an experience I had. So about 2 weeks ago, someone contacted me and said that they had tested positive for COVID-19, and they wanted to know if I had any recommendations for supplements. And what I had said was, you might want to check in with your primary care physician and see what they have to say. And this person had been told that if she quarantined for 10 days, she'd be fine, and didn't really give her any other guidance besides just staying home and quarantining. So what I had said is that, well, I have heard some stuff, and in the research that I've done, I've seen that there are some natural supplements you could use that may be beneficial to you. Now, there's not a whole lot of research out there, so it's very limited right now. But I did run across a case series. Now, this case series is basically a series of individuals that developed COVID-19 and were treated. And this was at an outpatient clinic. So basically what happened was that the people had COVID and they were told to take zinc supplements. So there were 3 individuals, and the physician monitored their entire progression through their course of the disease. And what they found was that individuals that were taking less than 50 milligrams of zinc a day typically had a worsening of symptoms. When individuals started taking over 150 milligrams a day, that they actually had an improvement in their symptoms. And using 150 milligrams a day basically was shown to help them eventually get over their condition and resolve the COVID infection. So it was shown to be beneficial in general. So I told this person, well, you might want to try taking 100 milligrams of zinc 3 times a day, at least 6 hours apart, and that may be beneficial for you. And then I had read something else about vitamin D. So I'd heard that vitamin D deficiency was associated with an increased risk of mortality or death because of COVID-19, or potentially they might have a more severe case if they had a deficiency of vitamin D. Now, as far as the research I've seen with how helpful it is to use vitamin D after you've contracted the infection, it's kind of all over the place. There's some studies that show, and there's not very many studies, but there are some that show that it's beneficial. There's some that show that it doesn't really help. And so it's hard to say whether or not using vitamin D is going to be helpful when you actually have COVID-19. Now, I do think that vitamin D could be something beneficial because COVID-19 is associated with this really intense inflammatory response in the body. Well, vitamin D is a very anti-inflammatory vitamin, and so it's something that's really beneficial for reducing inflammation. So I said, you might want to try doing vitamin D, 5,000 IU. And the last thing I recommended, again, was for inflammation. It was turmeric. Now, turmeric is something that's been shown to be beneficial for helping to produce antiviral activity. It has effects with boosting the immune system, and it also is going to be a significant anti-inflammatory. And I said, why don't you try taking about 500 or 1,000 milligrams of turmeric 3 times a day. And so I recommended that the individual take 100 milligrams of zinc 3 times a day, 1,000 milligrams of turmeric 3 times a day, and 5,000 IUs of vitamin D 3 times a day. And this individual was fairly sick for a couple days, and she ended up having a resolution of symptoms after about 7 days, which I think is about typical. So whether or not the supplements actually helped, I don't know. I'd like to think that they did, but I can't say that one way or the other. Anyway, the evidence would suggest that they potentially did help. So if you're worried about COVID-19, there's a couple things that I can recommend, and that is, why not supplement with zinc and vitamin D right now? So one of the things that I came across was that there may be a certain population of individuals that are more at risk of a zinc deficiency, which if a person has a zinc deficiency, they generally are going to have a more severe case of COVID-19. So the individuals that may be at a greater risk are individuals that are taking a birth control pill or using some kind of hormonal birth control, whether it's an injection or an IUD. Individuals that take an ACE inhibitor, and the ACE inhibitors are blood pressure lowering medication like lisinopril and things like that. Individuals that use a thiazide diuretic are more at risk. And then There's also individuals that are more at risk of a zinc deficiency, potentially if they're using painkillers. Now, that there's not as much evidence for the painkillers showing that they're at increased risk or anything like that. But the main things right now are the oral contraceptives, the thiazide diuretics, and the ACE inhibitors that definitely are associated with a reduction in zinc levels. So if you're taking one of those medications, you should definitely be supplementing with zinc every single day. Now, for vitamin D, basically it's been found in the research that individuals that are using about 1,500 to about 5,000 IUs every single day are much less likely to die from COVID, and they're much more likely to have a less severe case. So those would be what I would recommend for an individual if they want to potentially prevent or have a less severe case of COVID if it does happen. So hopefully you found this helpful. You guys enjoy your day.